So welcome to our next installment of At Home with Holland Home webinar series. I'm Michael Sliebel-Loafman, Director of Sales here at Holland Home, and we're really happy you tuned in today to talk about different levels of care and what is the right level of care for myself or my loved one. This really came out of a need. We get a lot of calls in our office, and we'll say, well, they say, I need some help. What are you looking for? Independent living, assisted living, skilled nursing, and people say, I don't know. And so hopefully today we're going to do some education on different levels of care, what those look like. And I am joined by three awesome professionals here at Holland Home. I'm joined by Amy Thayer, who's a senior living consultant here at Raybrook Manor. Jillian England, who is at our Breton campus as a social worker, and Tracy Jackson, who is the Director of Nursing here at Raybrook. So I'm really delighted to have these three experts with us today. Also on the call today on the webinar are the sales team, Cindy Price, Victoria Carson, Selena Meister, and Patty Alexander. So they're also on the webinar. We're going to go through some things, and then as always, as is our custom, we will have an opportunity for you to ask questions at the end. If you could put those questions in the Q&A section, not the chat. It's just very hard for us to manage both areas. If you put it in the Q&A, then all of the panelists can see it, and then we'll answer those unless it's really germane to what we're talking about at that moment. We'll probably just save those to the end. Our next webinar in August is going to be dealing with scams and how to protect ourselves. What are some of those out there? So that'll be another great webinar to tune into. One other thing, housekeeping, all of our past webinars are on our website, hollandhome.org/resources. So we have webinars on downsizing. We have webinars on our vibrant living aging model. We have it on the continuing care agreement. So a variety of things that you can then tune in. So again, delighted to talk to Amy, Jillian, and Tracy today on what level of care is best. So I'm going to just share my screen. And can you all see that?
Mm-hmm.
Yes.
Okay,
Yep.
great.
Yep.
So when we're talking about levels of care here at Holland Home, people that enter into Holland Home and sign a continuing care agreement, either at independent living or assisted living, this care kind of wraps around them. And so we're going to talk about these different levels of care. Independent living is probably where we'll start to say, what does that look like with independent living? Independent living is very much like its name. It's independent. People that live in independent living have a full apartment with a full kitchen, washer and dryer in it, and they're really pretty independent for whatever their daily needs are. We get a lot of questions, well, mom has a walker, can she be in independent living? Absolutely. Walkers, wheelchairs, no problem with being in independent living. Sometimes people in independent living need just a little bit of support, maybe some help with med management or something like that, maybe some bathing help. Well, then we would use our friends here at Atrio Home Care to come into the independent living apartment. That way people can stay independent, and if they can stay independent with a little bit of support in their home here, then very successful in doing that. Sometimes though, home care in independent living is just not enough. And so we look at assisted living. And so Amy and Jillian, can you tell us a little bit about how maybe assisted living would differ from what we just described there in independent living?
Sure. Assisted living is a great option when, as Michael said, home care supports just aren't enough anymore. And we always assess a person to determine what their care needs are. We look at something called ADLs, activities of daily living. and we find out what sort of help they need. As Michael said, having a walker in independent living, not a problem. But maybe someone is having a lot harder time getting around safely. Maybe they're having more falls. Maybe they're weak and need someone consistently to be walking alongside them. Things that interfere with safety and quality of life in independent living, we can often meet those needs in an assisted setting. Jillian, what would you say?
Yeah, absolutely. And I would say that some residents, can maintain independent living for quite a while, and they just need some support. So sometimes that's somebody coming in to help with meals, or like Michael said, medications. But when they're having a difficult time even remembering to take the medications, or they're getting medications mixed up, things like that, then that kind of support can be found in assisted living with 24-hour support and staff there to help with those safety concerns.
And not only safety, sometimes people start withdrawing from going to activities in independent living because maybe it's too hard to get to, or maybe they have some confusion and aren't able to recall where to go. And so having an assisted setting for them where they're invited to events and where there's staff to help them get there can help maximize just their quality of life, engaging and staying social.
Yeah, and one of the things you talked about yesterday, Amy, was this idea of kind of the differences between independent living and assisted, where independent living is kind of self-directed, and then talk about assisted living and maybe memory care.
Sure. So when I meet with people and we're trying to determine, okay, where should their loved one go? I do talk about how independent living is very much self-driven. Those people are really able to do for themselves, navigate their day, keep their own calendar, maybe some supports, but overall, they know where to go, when to go, things like that. Assisted living is still pretty self-directed, but with some aid throughout the day. Maybe they're being invited to events. We're helping manage that calendar. Like in assisted living, we'll come around and let them know when it's mealtime, or we'll let them know when events are happening. But those residents are still pretty self-directed. Whereas in memory care, a lot of those folks maybe don't have the ability to have that self-direction anymore. And they need the guidance. They need the intentional invitation to activities, and not merely an invitation, but an arm around them saying, we're getting ready to go have a baking activity. Come join us, and being guided to that activity.
That's great. And so tell me a little bit more. I mean, Jill, maybe a little bit more about that programming and the spiritual care that really is part of assisted living, because it's not just about care. It's not just about 3 meals a day that are provided as part of living in assisted living, but it's really a lot more than that.
Yeah, thank you, Michael. Yes, we use the vibrant living model of life enrichment and spiritual care throughout the whole continuum of care at Holland Home. So residents start usually in independent living, getting to know those activities and different programming. So under several different levels. So social, emotional, intellectual, physical, all surrounded and starting really with the primary pedal, which is spiritual care. And so there's lots of different ways that residents can take advantage of that programming, all different ways. And like Amy said, it's really self-directed and independent living, but that model moves through that continuum. So in assisted living, intellectual support and programming, we still have it. It just looks a little bit different than it did in independent living. And so, as well as, there may be a class that in independent living, residents going to go to, sometimes it's a high impact physical class. Well, it's going to look a little different in assisted living. Maybe we're going to be doing a seated class. And there's different ways. We do some live streaming, we do some in-person classes, but there's different ways that we do that across the continuum, even into nursing as well.
Okay, great. Amy, did you want to add anything there?
No, I agree completely with what Jillian was saying and was going to say, even in nursing, we have activities to reach out to the residents.
So maybe share a little bit, either Jillian or Amy, a little bit about how pricing works in assisted living, because it can vary.
Pricing does vary. It will vary based on a person's level of care. Excuse me. We have 5 different levels of care within assisted living, and we have 4 different levels of care within memory care assisted living. And those are all based on how much help a person is needing, what sort of medical oversight there needs to be. And we always conduct an assessment before someone moves in. So as a person does need more care, the price does increase.
Right. Anything else you want to help our viewers understand about assisted living? We've covered a lot of the high points, I think. If not, why don't we talk a little bit about skilled nursing? Our friend and colleague Tracy's been waiting patiently. Tracy, tell us a little bit about, we've kind of walked through this continuum of independent living, assisted living. How does skilled nursing differ from those other areas of care?
So with skilled nursing, we don't have levels, what Amy's was talking about. Typically, you would come for 2 reasons. A short stay, which is a rehab stay. Maybe you just had surgery on a broken hip and you just want to come and get stronger and go back to assisted living or even independent living. The other way that you would come to us in nursing is if you need long-term care. So with long-term care, we would provide all your med management. We have to have all nurses in our area. If you may still be using a walker or a wheelchair, however, maybe you need to use a mechanical lift to come to a sitting position or to get into the bed. And so we would provide those services using a mechanical lift. We also provide more staffing because in nursing, we provide services to a more medically complex population as well.
Mm-hmm. Yeah, I think one of the key differences you were talking about is kind of how it's two-person assist in skilled nursing. Yeah. And tell us a little bit about what the accommodations are like in skilled nursing.
So we have all private rooms. And you're able to have anything that you would like in your room to make it homely, your furniture, anything that would fit within that area. One of the differences I would say is that you have to have a hospital bed in nursing as opposed to independent living and assisted living. So that would be the major difference, I would say, with the rooms, would be the hospital bed, and we do not have showers in the room. We have staff that would assist you into what we call the tub room or the shower room.
Yeah, and then that differs a little bit from assisted living, correct, Jill?
Correct. In assisted living, the rooms have showers. And in memory care, however, they do not. In memory care, residents go to what we call the spa room or a tub or shower room, because oftentimes folks in memory care have some difficulty sequencing through that activity. And we can provide, everything from just minimal oversight and let the person do for themselves in the cleaning, or, hands-on care. But as Michael and Tracy were saying, our limit in assisted living is through a 1-person assist. Once a resident is consistently needing 2 people to assist them, then we do look at a skilled nursing placement, because they have more of the adaptive equipment and higher levels of staffing, as Tracy mentioned.
Mm-hmm. Great. Tracy, did you want to add anything else? What else would people want to know about skilled nursing?
If there is a situation where it is a husband and wife, we do, although all our rooms are private, we do provide, if you needed that, a semi-private where a husband and a wife could share a room. So you could still have that in nursing as well.
That's great. That's great. Yeah, couples want to stay together, and
Yes.
we have a little bigger rooms for that in skilled nursing. Anything else we should have covered maybe between, we've had a deep dive, somewhat deep dive in independent living, more so in assisted living, skilled nursing. Before we get to our questions, anything else that you think would be helpful for people to understand?
One question I will get sometimes, people will ask, does Medicare cover anything in assisted living? And the answer to that is no. Assisted living is private pay. It is up in skilled nursing where Medicare and Medicaid sometimes help cover the stay or a portion of it.
Yeah, great, good. Okay, that's pretty informative. And as hopefully people are watching, if you did not know already, healthcare, especially in this arena, in elder care, can be complex. It can be complicated and difficult, right? So that's why you want to choose a place like Holland Home that's been around 130 years, 5-star Medicare.gov ratings, to know where you or your loved one are going to be. So I see a couple questions as we're right at about the time. So Jane asked, this is for you, Tracy. What is the ratio of nurses to patients?
It is 18 to 1.
Okay, great. And what about an assisted living, Amy or Jillian?
At Raybrook anyway, in assisted living, we typically, the unit manager for whichever care unit a person resides on is generally an LPN. We have some unit managers who are have different training, but the staffing is more like 1 aide to 10 residents in regular assisted living. And we just have 1 nurse for the unit, which might be 40 people.
Okay. Which makes sense, right? Assisted living, little less.
Less acute.
Right,
Yep.
less acute, yeah.
Yeah. Jillian, how about over at Breton?
Yeah, we have in our area mixed diagnosis unit. So we have some residents that are there for physical needs and some residents that are there for more cognitive impairment needs. So we do have a little bit higher ratio there. Or well, maybe you want to say lower. It's 1 resident or 1 staff person to 5 residents. And then myself as the unit manager over there is social work. And then we have LPNs as well who are there during the day, 12 hours a day, 7 days a week. So it's generally 1 to 5.
Yeah, your setup is a little different at Breton because the units are much smaller, right?
Yes, correct. Yep. We have 15 bed units. We have 3 15-bed units. So it's set up a little bit differently. It's set up more like a home-like setting with the bedrooms around the outside and the living room and dining room area kind of in the middle of everyone's rooms. So we're able to do a little bit higher staffing as well, just because we do have some residents with that memory care need.
Yeah.
And I should add that our memory care units have a little bit better ratio for the residents. It's typically 1 caregiver to 6 residents. It's assisted living that's more like 1 to 10 during the day.
Great. Jane also asked, I think this is a pretty straightforward one. Independent living is apartment or home. Assisted living is a room. But what about memory care? And why don't we throw, Tracy talked about skilled nursing already, what that kind of looks like on a room, but memory care?
Memory care is a studio room typically with its own bathroom. All of our rooms have their own bathroom. Again, it will depend whether someone's in regular assisted living or memory care, whether they have a shower in that bathroom. We do have some 2-room units typically occupied by couples, but not necessarily, where a person would have a living room and a bedroom and then their own bathroom.
Great. Bill asks, how does one decide which level of care fits best for me or my loved one? Are there certain health markers or things that we should keep in mind? I don't know who wants to handle that one.
I can answer a little bit. Well, what I would say is it's so different for every person. You have some residents that come in that have a lot of support outside of their, individual living arrangement. So if they came into independent living, they may need some more supports that maybe some family members can provide. Maybe they're using Atrio for some private duty. And so you have some residents that would choose independent living, and you have some residents kind of with similar situation medically and physically who might choose assisted living because they don't have always the same support system. But I would say the markers generally we're looking for where we say we really encourage assisted would be, again, like if the person needs a one-person assist to, do their activities of daily living. So if they're needing help in the bathroom, if they're needing help getting dressed, getting up and out of bed and back into bed and things like that. Assisted living generally can provide a better quality of life for that person to start out with. So, and we also offer, like when your team, Michael, obviously meets with the residents first, oftentimes we can get called in, myself as a social worker here at the Breton campus, to have a meeting with the family and just really talk about that individual situation and kind of make recommendations that way. We really want to get you in the right environment as well, because we want to be able to support you in the right environment. So we oftentimes meet with people just to talk about that as well.
Great. Amy or Tracy, anything you want to add? That was a great answer from Jillian.
It was.
Want to add?
No,
I don't. I think she covered it.
I think so too. Very well spoken.
Yeah, rock star Jillian. So any other questions from our viewers? Just type it in. So this question comes from Doug. How are meals handled in the various levels? So why don't we start? I'll start at independent living. You can go down to the dining room, a restaurant. It's open at Breton 5 days a week. Our restaurant here at Raybrook is going to open this summer. You also have a full kitchen with stove, refrigerator, microwave, dishwasher, so you can do cooking in your home. That's how meals are handled here at in independent living. You can also visit one of our markets where you can purchase go-to meals that are already prepared by our chef. They're fresh. You don't eat them in the first 5-6 days. You can freeze them. So those are some options there for food support. Amy or Jillian, you want to talk a little bit about meals in assisted living, and then we'll talk to Tracy about skilled nursing.
Sure. In assisted living, we have scheduled meal times. 3 meals a day are provided as part of the package. And particularly with breakfast, I will get questions. People will say, I'm not an early riser. What if I come out at 9:30 and you've had breakfast at 8? We can set your food aside, or we can just simply know that you're not going to be having breakfast. That's okay. Residents pretty much anywhere can have their own refrigerator. We do ask in memory care that family or someone close kind of keeps an eye just to make sure that we're not growing science experiments in the refrigerator. But people can keep snacks in their room. They have that option for taking care of some of their own dietary needs by having those snacks and having a little independence that way. But we are preparing the meals, and none of the rooms in assisted living have kitchenettes. That's a frequent question.
Jill, do you want to add anything?
Yeah, over at Breton, in our assisted living, we have, like I had said before, the kind of smaller units. So we do actually prepare the breakfast, made to order in the mornings. We have people that are getting up at 6:30 for breakfast. We have people that are eating breakfast at 11:30 and kind of skipping lunch and eating a earlier supper. So we do have scheduled times for our larger, noon meal, which is dinner meal, and then our kind of lighter supper meal in the evening. But we also will kind of accommodate based on the residents' care needs. We just like you would do in your own home. Someone's coming late from something, and so mom or dad saves a meal, and we warm it up when the person gets back. We do that for residents as well.
Great. Tracy, tell us a little bit about how it happens in skilled nursing.
So we do provide all 3 meals. They are on a scheduled time, but they are served on the units. A combination between dietary staff as well as nursing staff. We do believe in person-centered care as well, which was what Amy had touched on. So you have somebody who is not an early riser. We keep things on the units like cereal, bananas, or we can also call the dietary staff and have something brought up for that resident.
That's great.
But have scheduled meal times. We have dining rooms, and we encourage everybody to come down to the dining room at those meal times. However, if they prefer to eat in their rooms, we accommodate that as well.
That's great. And Tracy, you were describing yesterday some kind of feedback that residents provide to Holland Home staff about food.
Yes. So we do what is called a resident choice meal. So currently we do it every quarter. Our goal is by 2023 is to start doing it monthly. So the residents, they meet once a month. We call it resident council, and they pick out different things that they would like to eat. Just to give a variety of meal choices. The last one we had was ribs, 7-layer salad, and mac and cheese. And they picked that meal. So I mean, shrimp, whatever they want. We try to, they pick five different ones, and we get it done. So yeah. So we do try to, meals is a big thing. That's the time for them to socialize, and I mean, you get tired of eating the same things over and over. And then, there was probably some recipes that they cooked when they were in their own home, and now they're here with us and they can share those recipes with us.
That's awesome. And I don't know about everybody else, but I'm getting really hungry now after hearing all that. Dewey, thank you so much. And I love the fact that we try, it's not just like, look, here it is. This is what you're going to have, but trying to have some of that feedback from residents is so critical. So any other questions from our viewers? I don't see any more. As we look for any other questions, Amy, Jillian, Tracy, any other things you want to add before we kind of sign off here? We've really covered it pretty well. So
Nothing comes to mind.
So I really want to thank Amy Thayer, Jillian England, Tracy Jackson for spending time out of their really busy day to help in this webinar. We hope that this is going to be informative for residents and prospective residents as they think about what levels of care are right. This will be posted on our website early next week. So stay tuned for the next At Home with Holland Home webinar that will be in August about scams. And until then, we thank you so much and really have a wonderful day. Take care, everybody.
Thank you.
Thank you.